So ladies and gentlemen, I ask myself questions, and I think it deserves for each one of you to ask yourself the same question. Are we doing the right things for our patients? Definitely no. Why? And for that, I thought just to go back again from the...
Above all, Zurin suka bila doktor tu cakap kita jaga physically of patient, tapi kita lupa dia punya emotionally and soul, body and soul. Assalamualaikum warahmatullahi taala wabarakatuh. Bismillahirrahmanirrahim. Thank you kerana menonton vlog Zurin Ayan. Baiklah, hari ni Zurin bersiaran di hotel Grand Continental Jeddah. Baiklah, hari ni Zurin ada nursing conference, tajuk dia Global Future of Nursing Evolving Today to Achieve Tomorrow. Yang ni first symposium yang diorganize oleh IMC International Center. So IMC ni hospital private yang ada dekat Jeddah. Baiklah, kita ada banyak topik lah, topik-topik yang menarik. Banyak topik yang menarik lah yang diorang bincangkan hari ni. Ni dia punya booklet dia. Salah satu yang menarik perhatian Zurin adalah tentang virtual nursing. Virtual nursing. Sekarang ni kita more to backside. Memang backside nursing, tapi in future mungkin virtual nursing ni akan jadi salah satu apa orang kata? Virtual nursing ni akan salah satu perkara yang normal. So sekarang ni diorang practice virtual nursing ni untuk admission, discharge, health education. Dia membantulah. Somehow dia juga membantu dalam nursing shortage. Sebab Zurin tak tahu sejauh mana dia akan diterima, sebab mereka masih lagi dalam fasa study dekat Mayo Clinic. Diorang punya speaker juga bukan calang-calang lah, diorang punya speaker. So Zurin memang rasa macam wow, I'm so sangat impressed lah. Salah seorang dia ni, yang ni yang cerita pasal virtual nursing ni, daripada Mayo Clinic USA. Lepas tu beginning session dia ada buat macam presentation tau. Dia ni perempuan ni, dia seorang fotografer dokumentari. Yang ni memang best. Dia memang dokumen kisah tentang nursing. Ada jugalah selit juga tentang nurses burn out during pandemic. Memang tak dinafikan lah kita nursing ni bila during pandemic hari tu memang especially dekat poor country lah, diorang memang burn out sangat-sangat lah. So ada juga diselitkan tentang pandemik hari tu. So memang sangat best. Kalau tanya Zurin hari ni, alhamdulillah Zurin dapat attend kita orang punya nursing day hari ni, untuk kita orang punya symposium. Kita orang dah nak start. Okay, so jom tengok reflection pagi tadi punya session.
And actually, I have a question for Dr. Jason. I've been following the topic about Vern for some time now. There's been discussion on AUNL also, in their chat group there. You've mentioned at the end of your presentation that Vern is a need because there's not enough of us, right? So will there ever be enough of us?
Yes.
And the second question is, well, it relates to it. What if Vern becomes the new normal? Would that contribute to not having enough of us?
Wow, nice.
So yes, thank you for the question.
I love it.
I'll answer the last one first. Yes, I think Vern is going to become a new normal.
New normal.
And the reason I say that is that we've seen throughout our entire profession, how we've used technology to augment the practice, the care of patients, and other things. I mean, we started with, I think, things that we take for granted, IV pumps, monitors, all sorts of things that we don't even question anymore as part of our practice. This is different because it feels like it's part of my practice. It's actually something or somebody doing my job. But we're all nurses. We've got to think and do things differently. And so the reason I say it's part of what we will is because I think it will transform our practice and become part of what we're going to do moving forward. And that will allow us, hopefully, to use technology to, in some way and in some essence, use less of us to do the exact same thing or better than we're doing today. And that's not a slight on our profession. That's just an advancement that we've seen over, of course, go back 100 years, how our profession is advanced. This is another one of those sort of cornerstone advancements that I think we'll see.
Okay. Okey, berakhir sudah conference kami untuk hari yang pertama. Wow. Zurin ada tiga speaker untuk petang ni. Salah seorang dia Dr. Ashraf. Tak silap Zurin, dia seorang director dekat IMC, Internal Medicine, dekat IMC, International Medical Center. Dia punya talk memang sangat best. Memang amazing. So jom kita tengok dia punya sikit talk dia yang kita boleh ambil daripada dia punya talk tu. Jom.
I just want to share with you a concept that I truly believe after many years. My concept, many of you might agree, many of you might not, but the reality is that it's reflected in changing my way of practice of medicine and how I look into patients and how I look to my nation, how to look into my healthcare system, to be proactive, to do something that has a value at the end of the day. So the concept is that regardless, I'm a physician or a nurse or a technician or a healthcare provider or even a decision maker, we have to get out of the box. We have to get out of the walls of our clinics, out of the compound of our hospitals, to reach for the community and to explore what we are encountering at the level of the nation and the level of the community. Questions, and I think it deserves for each one of you to ask yourself the same question. Are we doing the right things for our patients? Definitely no. Why? And for that, I thought just to go back again from what he said. He said, الطب هو حفظ صحة وبرء مرض. It means medicine is preserving health and treating disease. So it comes first prevention and then treatment of disease. And that's why we have to move from intervention to prevention, from disease to health, from illness to wholeness. And this is the new strategy to modify our healthcare system. This was not enough, ladies and gentlemen, for me to understand exactly where I'm standing. So I thought to understand exactly what is the right definitions of health. Definitions of health, which was stated elegantly by the WHO, they said it's a complete state of physical, mental, social, and spiritual well-being, and not merely the absence of disease. Unfortunately, we focus on the physical part of our patients. We ignore that the patient is body, mind, and soul, and that's why we are so defective to tackle the disease that we have been seeing, that it's almost like a tsunami coming to hit our healthcare system, not only the kingdom, but also globally. So what we have today, ladies and gentlemen, we have our system is an organ-oriented departments. The human being or the patient has been fragmented into different pieces, small pieces that is related to different specialty, and that particular specialty is grabbed by the specialized people just to deliver the curative part to that particular disease. So we don't have, unfortunately, we don't have a health caring system. What we have is a disease curing system.
Kan, best kan? Doktor tu cakap above all, Zurin suka bila doktor tu cakap kita jaga physically of patient tapi kita lupa dia punya emotionally and soul, body and soul. Tak, macam mana physically, body and soul. Bukan. Fai, apa dia cakap tadi? What he said? Physically, body and soul. We are taking care physically, but we forget about the soul.
No.
No.
being healthy was defined as being not only being free from disease, but it means being good physically, mentally, and spiritually.
Yes.
But what's happening currently, it's we are just curing the disease,
Yes.
but not that taking care of the health itself. Not taking care of these three things: the physical, the mental, and the spiritual.
And spiritual.
Yes.
But nice lah. The
Very nice.
the Dr. Ashraf is very nice as well.
But I did not.
He left already.
Yeah, that's why that's
It's very nice. Speaker ni dari everywhere, international. Ada yang daripada ada seorang speaker ni, dia daripada Jordan. Dia punya speak pun sangat-sangat best. Dia salah seorang yang berjaya untuk dapat hospital dia untuk dapatkan recognition as a magnet hospital. Apa yang Zuri nampak kat sini, magnet hospital ni macam sekarang dah start grow tau. Everywhere hospital cuba untuk mendapatkan magnet recognition ataupun certificate magnet ni. Kan I don't coffee. You want?
You take I want my bed.
Intan post night. Jadi baiklah, sampai sini saja perkongsian Zurin untuk Symposium di Jeddah. Okay, sedikit tentang our nursing life. Okay, kita orang sentiasa kena up to date. Kita orang punya current what to say, up to date. What we are doing is we are up to date our current practice.
Updating, keeping up with the trends.
Yeah, we are keep on updating to the trends. So, yep. Sampai di sini saja perkongsian Zurin untuk vlog Zurin hari ini. Okey, terima kasih. Assalamualaikum. Sesungguhnya yang baik itu adalah daripada Allah Subhanahu Wa Taala. Kekurangan itu datang daripada diri Zurin sendiri. Terima kasih. Assalamualaikum.